Hi everyone, Brian Lewis here with Kidney Can, and it's my pleasure to welcome you back to another joint edition of the National Kidney Foundation and Kidney Can's NKF Live series. Today we'll be discussing the topic of physical fitness as it relates to kidney cancer. And my guests today include Barbara Trencher. Barbara's the physical therapist who specializes in working with cancer patients. And also with us today is Bruce Hill. Bruce is a person living with kidney cancer who's an avid fitness buff, and he's graciously agreed to share his experience with us. Thank you both for joining me today.
Thank you for having us.
Great. Let's dive right in. Bruce, tell us a little bit about your kidney cancer experience so we can gauge it in terms of exercise and fitness.
Yeah, sure. So in 2017, I was a pretty healthy young man in my 40s and probably as healthy as I'd ever been or as fit as I'd ever been. I was working out weights and calisthenics type exercise all the time. I was playing competitive soccer. I was hiking with my family quite a bit. And then all of a sudden I went on a long hike with my family and found that I couldn't keep up. And I felt really winded and out of breath and thought something was wrong. So I went to my doctor, and as soon as I walked in, she looked at me and said, "You're anemic." So something was very wrong with my blood system, and something was causing me to be anemic. So I couldn't keep up. I thought I was pretty fit. So went through a series of tests. Eventually a CAT scan and an MRI revealed that I had a significant tumor on my right kidney. And so the first thing I had to do there was to have surgery, and had a radical nephrectomy and actually had to remove the entire kidney along with the tumor.
Okay, let me interrupt you right there for a second and ask Barbara. So with kidney cancer, a lot of times one of the sudden incidental findings is that you are going to have surgery and you don't have time to prepare for that surgery through fitness or exercise. Can you give folks that are listening some information on getting ready for surgery if they have time?
Sure. So I think it's great that Bruce was so fit when he was going into his surgery, because that undoubtedly made his recovery easier. I'm sure that your recovery was rough. But people who go into surgery already fit have a benefit, because one of the main issues when you're recovering from surgery is cardiovascular function, making sure that you're getting up, able to move around, make sure that your lungs are working well. Mm-hmm. One of the reasons doctors want you to get up right after surgery is to make sure that you don't get pneumonia. And so Bruce had an advantage, and I would say that anybody who's about to go into surgery really wants to do whatever they can to go into it as fit as possible. Even if you just have a few extra days, get up, move around, walk around.
Everything helps.
Everything helps.
Okay. Mm-hmm. Bruce, sorry, let's go back to your story. So you had surgery?
Yeah, and of course the first few weeks at home were tough. It's definitely some time of convalescence, but I found that, and my wife was instrumental in this, getting me up and out and do some walking was very helpful. It made me feel stronger, and then as we progressed along and I continued to recover, we'd go on a little bit longer walks, right? And I may not have been hiking and climbing a mountain anymore, but I could still go on a lengthy, flat walk, and not stress so much as with climbing a mountain. But we really got into getting out and exploring, and where can we go to find places to go see and spend some time outside and at least get out there and walk.
Got it. So Barbara, at least maybe my interpretation of fitness usually involves like the gym and sweating. Mm-hmm. I mean, can you talk to us a little bit about other things that you can be doing, maybe walking or other types of exercise and fitness?
Yeah, so walking is excellent exercise. Anything that really gets your heart rate up and going. You want to be on your feet, doing some weight-bearing exercises, using your muscles, because you want to make sure that none of your muscles are starting to waste. So post-surgery, people don't feel great, and they really want to just lay on the sofa and do nothing. While that's really appealing, it's not really the right thing to do for your body. You want to get up, get on your feet, get your heart rate up. Even just going up and down the stairs in your house is going to get your heart rate up. And it's a little counterintuitive, but ultimately it's going to make you feel better.
Got it. So I'm just curious, Bruce, you during that convalescent time probably were on the couch like me. Sure. What were some of the things that motivated you to make that first step?
Yeah, obviously, for my own mental health, I wanted to be able to, get outside, be active. I felt like, maybe my muscles were starting to atrophy and losing any definition I had or anything like that. So I wanted to get up and move and for my own mental health and realize that being out there and getting some exercise would probably benefit me. So it was self-motivating.
Did you set some kind of strategy out first, like I want a goal of running a 5K or anything, or do you just
nothing like that. I mean, I think I wanted to get back into hiking and real hiking and going up mountains in the area, and I wanted to get back to if not playing soccer, maybe at least getting back to the soccer field. And actually what I did was I got into refereeing instead of playing. Because, playing soccer, there's that physical aspect, and the fact that I had one kidney, I was a little concerned about that, but I could still be on the soccer field as a referee and still run around. So I had a goal to get back to the soccer field. That was a good one.
So Barbara, for the folks out there that might not be as active and not out going or running marathons, can you give them some advice to make that first move?
Yeah, so Bruce is really kind of the dream patient for any PT who works with patients who have cancer, because he's self-motivated. He doesn't really need a PT to tell him what to do. Most patients aren't, getting off the sofa and planning to run a 5K. A lot of people who don't have cancer are getting off the sofa to run a 5K. So I would say it's about small steps. So get up, move around the house if you feel like you're able to, and progress to going up and down the stairs 2 times. Try to get your heart rate up. That's really what the data is showing is most important, is you want to get your heart rate up, get the blood flowing to all of your muscles, all of your body really. So if you can do the stairs 2 times in your house, do that every day. And then the following week, try to do it 3 times. Okay. Those are the little things you can do. Or go to the mall and just walk around the mall. That's a safe, flat environment, and get outside.
Do you have any recommendations or thoughts around keeping track of your steps and if you're getting started?
Well, there's this buzz of the 10,000 steps, but for a lot of patients, that's really not going to be a realistic goal. Just after surgery, a lot of people aren't doing 10,000 steps any
who
day.
are physically fit.
Exactly. So I would say do the best you can. My focus is generally telling people to get their heart rate up. I'm more interested in get your heart rate up for a few minutes, bring it back down, get your heart rate up for a few minutes and bring it back down, not necessarily the number of steps that you're doing.
Okay. So if they're working around the house, that might qualify, like doing chores and things.
Yeah, absolutely.
Okay.
Yeah, and Brian, one thing that we did, my wife and I, so after surgery and recovery is pretty much complete, still had to go for things like blood work and CT scans and things like that, right? So you might have to travel to a hospital or a facility that's kind of outside your town, far away. So we'd find a place nearby that maybe we'd never been to, and it might be a place where you could go for a walk, right? So we'd go, we'd do the appointment, and then go to that spot that we'd never been to before, just to kind of explore, and and go for a walk, right? So that was just another motivator to, because you're in an area you're not normally in.
So it's turning sort of maybe a bad experience into a good one with doing that. That's neat. Good idea. Yeah. Barbara, we didn't really touch on, but can you tell the folks, what are some of the benefits of exercising? Just sort of the basic benefits. It's good for all of your immune system. So
this is a really exciting area that's really opened up probably in the last 10 years, is the relationship between exercise and cancer treatment. So a lot of cancer patients have some cardiotoxicity, some damage to their heart from the treatment. Patients experience what's called cancer-related fatigue, which is different than just being tired. Mm-hmm. A lot of patients have anxiety, depression, and then we touched a little bit earlier on the issues of weight loss, muscle wasting. Some patients actually gain weight during cancer treatment because of steroids or other issues related to the treatment. And exercise can really counter all of those side effects. There's some excellent data about countering those side effects. And is it something that has to be done religiously every day, or can you miss a little bit? What happens if you don't feel well? Yeah, well, if you don't feel well and you're not able to get out of bed, obviously, I wouldn't encourage you to get out of bed on a day that you really feel terrible. But if the issue is that you're fatigued because of cancer-related fatigue, although it's counterintuitive, there's a lot of great data that says if you get out of bed and exercise, it will counter that cancer-related fatigue. So the American College of Sports Medicine has guidelines that recommend 150 minutes of exercise a week. And so that comes out to about 30 minutes a day, 5 days a week, which interestingly is the same guidelines that are there for the general population.
Okay. So every day, on average, 30 minutes
Yes.
is what we're targeting.
That's the general recommendation from the American College of Sports Medicine. I would encourage everybody to try to do some higher intensity exercise a couple times a week.
So on that note, talk a little bit about, and both of you talk about variety. I mean, there's walking, there's those that can run, rowing maybe, stationary rowing. What are some of the other things that you could recommend folks might do? Or maybe not even in the gym that they could do. We heard about hiking.
Yeah, I mean, weightlifting and doing it in your own home. I mean, if you've got some weights or something heavy that you can lift, that's great. I go on YouTube. There's tons of free in-home exercise videos that you can watch. They don't cost a cent. You just bring them up, and I do a lot of that. Get up in the morning, go down to the basement, and lift some weights. I got into bicycling again. Of course, in high school I was biking, but not intense biking. But over the pandemic time frame, I really got into riding a bike again, and discovered that that's a great way to get outside and exercise and get some good cardiovascular benefits.
So are there some others, Barbara, like is gardening qualify or?
I suppose it depends how vigorous your gardening is.
Yeah.
I think that gardening probably could qualify. I love the biking because biking is somewhere where you can really get your heart rate up and back down again. But as I mentioned to Bruce earlier today, biking scares me a little bit because I don't want to fall outside.
Right.
So stationary biking is a great opportunity for the same benefits. But really, it depends on the person and what's going to keep them doing it. So to me, there's no specific activity that's most important as long as you can find something that you'll do regularly, that'll get your heart rate up. So whether that's rowing or swimming or running, treadmill, elliptical, anything that's going to get your heart rate up is a good idea.
So on that note, Bruce, sounds like you've done a lot of solo training, but also with your family. Are there benefits to finding a partner to do this with?
Absolutely. A lot of times, if you find a partner who's going to keep you motivated and who's going to help keep you sticking to the plan. There's also, I would suggest, some group exercises classes out there that are specific to cancer patients, but then there's also group exercise classes that aren't specific to cancer patients. It's really what's going to keep you interested.
Okay. Neat. So I heard this phrase from you earlier, and I want the audience to hear about it. The rate of perceived exertion.
Yes. Yeah.
RPE.
Yeah.
So tell me about rate of perceived exertion.
So as I mentioned, the data right now really focuses on what's called high-intensity interval training, which I know can be
high-intensity interval training. Okay.
So in high-intensity interval training, what we want is for your heart rate to get up into that 7, 8, 9 range for anywhere from 30 seconds to 2 minutes. And this is something that you're exercising so hard you can only maintain it for that brief period of time. And then after that period's over, you let your heart rate come back down into the 4, 5, 6 range for the same amount of time. And then you go back up into that higher range.
Okay.
And that's where the data has really been focusing lately on where the most benefit for cancer patients is.
So using the 30 minutes a day average, 5 days a week, you got 30 minutes and you were trying to get a couple of minutes or 30 seconds to a couple of minutes of that 30 minutes up, and then you come back down. So is it like a couple of minutes up and then you rest, less exercise, less exertion for a couple of minutes?
Right. So when I teach a fitness class for cancer patients, what we do is we'll have a 30 to 45 minute class. And for every other song, we'll do the high intensity part that's more aerobic in nature, so more jumping jacks, more movement. And then for the next song, we'll do a lower intensity. And during that period, we'll do some weight training or use some TheraBands to try to increase.
And bring your heart level down and
Exactly.
get ready to go again.
Exactly.
Now, if you're participating for the first time or early on and you can't keep up, what do you tell folks that maybe
Yeah.
can't do
Yeah.
the whole song?
Well, what's great about the rate of perceived exertion is it's very individualized. So for one patient, that might be just walking in place, and that's going to get their heart rate up really high because they don't have a lot of experience with exercise. But for somebody like Bruce, it's going to take more than that. So maybe he's doing very intense, very fast jumping jacks to get his heart rate up that high, and it's very individualized.
Got it. Bruce, you concurring on all this so far?
Oh yeah. I mean, some of the training that I talked about that's available on YouTube. There's all kinds of HIIT instructors out there that will do that, instruct that, and get your heart rate up certainly easily. And you can do that right at home for free.
And so I heard you say something earlier, Bruce. It was intriguing that there was things that you could do pre-cancer, and now there's things that you can do now, and
Right.
the contrast there. It's sort of a mental issue there going on too, right? Or
Sure, that's part of it.
psychological.
I mean, some of it's psychological, some of it's physical. I mean, there's certainly things that I limit myself because I know that I've only got one kidney or I've been through a somewhat traumatic experience in my body, right? But I mean, for the most part, I can still, run and bike and hike and do the things that I want to do without, just being careful of the physical side of things, right? Physical contact.
So Barbara, talking about the classes that you hold, tell us about age difference. Do you train folks differently or have them not compete, but participate at different levels based on age or?
So Cancer Fit, the organization that I work for, has patients with from every age range with every type of cancer. So we may have very young patients. Everybody's an adult. We don't work with kids. But we have very young patients, and then we have much older patients, and they can be in the same class. We may have a young person in her 20s, and then we may have a much older person in his 80s in the same class. But because we're focused on this rate of perceived exertion, they can participate in the same class together. And that goes for patients who have some limitations with mobility as well. So patients who are in a wheelchair or who aren't able to stand for long periods of time, they're still able to get their heart rate up through the exercise.
Can you give some examples for folks that might be listening? So, we understand the aerobic side of things, but for those that might be, in a wheelchair or might not be able to move around as much, what do you recommend?
I would say the same thing. So if you look online, there are exercise classes. We have some, Cancer Fit has some in our own library that can be adapted to the chair. So for example, if you can't march in place, you might be able to sit in the chair. If you sit on the edge of the chair with your hands here and march in place really fast for 3 minutes, you're going to get your heart rate up.
Okay.
Yeah.
So just being stationary, but moving in a stationary.
Not everything has to be full weight bearing.
Okay.
Yeah.
All right. So I want to shift a little bit to fatigue. Did you suffer from fatigue, Bruce?
Oh, sure. Well, leading up to it, I certainly did. Right, when there was this tumor in my body, and it was consuming a lot of the blood and oxygen in my blood. I suffered a lot from that, and then post surgery. Yeah, I mean, for the first few weeks, it was very slow to kind of get my stamina back and work up slowly. And like I said, we did that. We kind of managed it and set some goals, and eventually the fatigue went away. Yeah.
Can you give some insights into if someone's out there that is feeling tired? What do you tell them right now, or what they should go see someone or?
Right. Well, so first I want to emphasize that cancer-related fatigue is very different than fatigue that somebody in the average person in the population might feel. It can be quite overwhelming, and then treatment from cancer can also cause cancer-related fatigue. There is some excellent data that shows that exercise can counter the effects of cancer-related fatigue. So even if you're feeling this overwhelming sense of fatigue, it's super important to get up and move around because it really will counter some of that fatigue.
Yeah, I personally remember having never felt that way before in your life. It's sort of a new experience where you physically are sitting there going, I've got to force myself to stand up.
Yep.
But that's the solution, part of the
Right.
solution.
Part of the solution is to stand up. Yes.
And along with the fatigue, sometimes there's muscle loss.
Yes.
So can you comment about that? That's
Yeah.
sometimes after surgery as well, or
Yeah.
just
Yeah. Sometimes that can be caused by the cancer or the treatment, but frequently that is caused by this issue of fatigue, or patients who feel too sick to get out of bed or are recovering from surgery. And the best thing to do for muscle loss, again, is to get up and move around. I think Bruce's suggestions with the weight training are great, but sometimes you don't even really need weights to do it. You really just have to move. Your own body weight can be the best weight for that.
Got it. All right. So I think we're going to start. I think I'm getting the signal here. It might be time to look at some questions from our audience, the folks that are watching. I'll just remind everybody that is watching, if you have any questions on this subject, please post them in the comment section and we'll do our best to answer as many as we can. If we do run out of time, please know that all of the questions will be addressed on the NKF's and Kidney Can's Facebook pages after the program. So I did have a question that was passed over to me. I've heard yoga is really great for cancer patients. What can you tell me about that, and is it the best exercise?
Right. Yoga is wonderful. And a lot of people really do benefit from yoga a lot. It can be particularly helpful with the anxiety and depression that often accompany a cancer diagnosis and cancer treatment. But it hasn't been the focus of Cancer Fit because it's not where the data is right now. The data is really focused on high intensity interval training. So if you have to choose an exercise and you only have time for one, I would really encourage you to do high intensity interval training. If you have time for both, do not give up your yoga because you're definitely getting something from it. But I can't emphasize enough how important the high intensity interval training is.
Okay, and so I'm just trying to think of some of the other examples of high intensity. There's of course going into the gym and working with a trainer if you can do that, but is swimming?
Yes, absolutely. And you can do swimming as you can do it, slowly in the pool, just walking through the pool. And then you can get those 30 seconds to 3 minutes by pool running or swimming laps or kicking really hard. Absolutely.
Okay. Are other examples that you might throw out there for people that might not?
Yeah. I would say up and down stairs. That is, if you are at home and there's nothing else that you can do, or you have limitations on where you can go, or you aren't a member of a gym, just going up and down stairs, everybody gets winded on stairs.
So skip those escalators every time you get a chance.
Don't take the elevator.
Okay.
Just do the stairs.
All right, I'll remember that when I walk through Penn Station later. So I'm curious, from a resource standpoint for folks out there, can you recommend resources that they might find classes, or they can find your website? Or
Yeah. So my organization, Cancer Fit, our website is cancerfit-EBE. That stands for evidence-based exercise. And we have a whole library on our website under patient resources. The password's really tricky. It's Cancer Fit. So we have a whole library of high-intensity interval training classes there that you can do at home. But I also encourage people just to generally look on the internet for classes.
Yeah.
Okay.
Yeah, I mean, for like I mentioned earlier, YouTube is a great source for exercise. Their classes, there's advice. It's really a great source.
And you might even
most
type
of them
in,
are free.
type in a search that says, I'm looking for something not super intense.
Yeah, you can do that, right?
Yeah.
Sure. Yep.
that'll come up.
Absolutely. Yeah.
And I would also note that a lot of medical centers have exercise classes available for patients. Some of them are free, some of them aren't free. Any of the major cancer centers probably has some type of exercise class available.
So check with your local
Absolutely.
healthcare
Yep.
provider and see. Maybe the nurse providers or the doctors there will be able to recommend, or they might even have something within the institution.
Right.
to
For
join in.
example, we at Cancer Fit were in New York at Columbia and NYU, and so if you were to ask at those medical centers, they would hopefully send you to us.
Got it. Do you participate other than any organized group activities for fitness?
I mean, unless you count refereeing soccer, yeah.
That counts.
I mean, yeah, that's certainly an organized thing, but I don't participate in any group exercises or anything like that.
Got it.
right?
Got it. All right. Well, let me see. I did hear something I wanted to hear a little bit more about. You said EBE, evidence-based.
Evidence-based exercise.
Tell us a little bit about
Yeah.
that.
Well, what that means is that we look at what the data, the scientific data, is showing about the relationship between cancer, cancer treatment, and exercise, and try to really focus what we're doing at Cancer Fit on what the data is suggesting is most beneficial to patients. And so that's why our focus is the high intensity interval training. That evidence-based exercise has become a bit of a buzz because it makes sense, right? We want to look at these large-scale studies of what patients are being asked to do. In Australia, actually, they've been doing this for a number of years based on what the data is showing is most beneficial.
So are there certain institutions that you could point to out there that might be a good resource to go take a look at that have been specializing in EBE or?
I would say if you're interested in learning more about this, about what the data itself is showing, if you go to Google Scholar and just type in cancer and exercise or cancer and HIIT, you'll see a lot of studies that come up that really show the relationship between exercise, cancer, and cancer treatment.
And maybe YouTube as well.
Yeah. Sure.
Good. All right. I also, I think we're starting to get close to the end here, so I want to ask a couple of things before we get too far away. Some recent data is I guess expressing that there's a reduction in recurrence, possibly.
Yeah, so this is one of my favorite areas to
Sorry,
talk about.
I butchered that. By the way.
So there's new research, exciting research, I think, about the relationship between exercise and potentially reducing recurrence rates and improving survivorship. There's a lot of funding that's going into this area right now. There's a lot of researchers who are focused on this. There's some very cool studies out there in mice. So mice are not people, and their systems work differently than ours do. But there's some really interesting research that shows a huge reduction in the spread, what we call METs or metastases of cancer, and the potential for this improvement in recurrence rates and survivorship. So it's a very exciting area.
Yeah, I mean, I like to think that what I've been able to do since, since my surgery, since my treatment is over, I'm no evidence of disease right now, and have been that way since early 2019. But I've continued to stay fit, right, and exercise. And I like to think that has had an impact. I mean, I don't have any scientific evidence of that, but I certainly feel like I've stayed fit, and hopefully that has helped.
Good. Looks like another question that was getting passed over here. My treatments have given me neuropathy, which I'm not exactly sure neuropathy.
I know what that is.
So my balance is poor. Is it still safe for me to exercise?
Yeah, so neuropathy is a peripheral nervous system issue where patients can lose feeling in the tips of their fingers and on the bottom of their feet, and that can really impair balance. And so what we say to patients who have neuropathy is, hold on to something when you're exercising. If you're going up the stairs, you should probably be holding the rail anyway. But if you're doing an exercise class in place, have a chair next to you and just put your hand on the back of the chair to help maintain your balance. But it certainly shouldn't be a reason not to exercise.
Great. Well, we're starting to run out of time here, so I want to finish up on a high note, I hope. Next week is Thanksgiving. A lot of food coming around for a lot of us. Maybe too much. What's some advice before people sit down or after they sit down next week?
I would say look into a turkey trot. I think that they're really fun. They're not necessarily a run. Sometimes it's a 5K, sometimes it's 2 miles. Sign up for one of those and get some exercise in.
All right. Bruce?
Yeah, we always go for a walk before dinner, or maybe toss the football around outside after dinner. So any of those fun activities to do right around Thanksgiving.
Excellent. I'm getting hungry, and then I'll do some exercise. So, unfortunately, folks, we've run out of time again. In case we didn't get around to answering your question today, please check back on the NKF or Kidney Can's Facebook pages, and we'll be posting those answers throughout the coming days. I'd like to take the opportunity to thank our sponsors for their generous support in making this program possible. And I'd especially like to thank Barbara and Bruce for joining us today and helping to make sense of what I know can be a very difficult subject for so many people. Thank you both.
Thanks for having us.
Thanks for having me.
On behalf of the National Kidney Foundation and Kidney Can, I'd like to wish you all good health and a happy Thanksgiving. Thanks a lot.